Hello, and welcome to Pittsburgh City Council's post-agenda meeting for Wednesday, October 7th, 2020. My name is Kim Clark Baskin, and I'm the Assistant City Clerk. With us today, we have our sign language interpreter, Nick Miller. The following is a topic up for roundtable discussion, meeting called by Councilman Corey O'Connor. There will be discussion on justice-related and human services. That concludes the topic for discussion. Thank you and have a wonderful day.
Good afternoon and welcome to City Council's post agenda on justice related services as well as human relation services as well. So I'm glad to be hosting this. I'm Councilman O'Connor. We're joined by, at this point, Councilman Wilson. So I want to thank him for being here. We have a number of speakers this afternoon from the county as well as from Connect. We do also have Laura from the city is going to chime in if any of the council members at the end of the presentation have any questions that are related to the city. But obviously we thought this was a really important conversation, especially now we're leading into the budget and public safety has been a huge conversation throughout the last few months. Being chair of public safety, I think it's important to see what types of services are out there that we already have worked with, but also ways that we can fill the gap to help not only our public safety department, but as well as our residents and get them the services that they need throughout the city of Pittsburgh. So I will actually begin with Connect. And I know that there are a few speakers, but if Lydia, if you want to take over, we'll start with Connect and then we'll go down the list. And I'll offer it to Dan, Jennifer, and Aaron from the county. I'm not sure who wanted to go in what direction, but you guys feel free to jump in whenever you want. But we'll start with Connect's PowerPoint, then we'll go to the county, and then we'll take questions after that. So pass off to Lydia. Thank you very much for being here.
Great. Thank you so much for having me, Councilman, and great to see everybody who's here. For those who don't know me, I'm the Executive Director of Connect, which is the Congress of Neighboring Communities. And it always helps to set a little context. So I will give you the who, what, where of Connect and a bit of some of the stuff that we've done in the past. As you can see, there are a lot of governments that share a border with the city of Pittsburgh. We bring those all together to work on cross-boundary challenges. We know those boundaries are porous. We know that there's a lot of local talent and leadership, and networking us together is really the only way to solve regional issues. We've been lauded as a national model because so many regions, have the same sort of tricky issues where there's lots of border sharing, but, jurisdictional equity at the forefront. So, our members are the municipalities themselves, and they designate 1 to 3 elected and appointed officials to be the representatives to Connect. For the city of Pittsburgh, you have the mayor, you have Councilwoman Deb Gross, and Michael Lamb. Those are your 3 representatives to the city. And so in addition to those, we have a lot of other folks who come to our meetings, but those are the folks that can vote on behalf of the annual legislative session that Connect convenes. And you're looking here at a photo of one of our annual legislative sessions, which serves as almost a strategic planning process to what are the high priorities, what can we do together, what levers can we pull, and what resources can we leverage if we come in all together. And we have to give credit to the city as one of the biggest municipalities within that. Allegheny County is the only one that's bigger that's within Connect. There's a lot of thought leadership coming out of the city, and we do appreciate that. So you look at our board of officers, there's about 100 people who technically are on the executive committee, but the board of officers is really that steering committee. And it's always the county executive. It's always the mayor of Pittsburgh. It's always an elected official for our chair from a municipality that isn't the city. It's always a manager from one of the municipalities. And we always have a treasurer secretary who tends to be a manager as well. So what is Connect? We are a lot of things, but primarily we do the intergovernmental affairs work that we know has been disinvested in for the last 30, 40 years. In the 60s and 70s, there was a lot more money and funding available to facilitate conversations and communications and coordination between government departments, between different agencies, and between the citizens themselves. We haven't had as much investment in that for my entire career, probably for everyone's entire career that's here now. And so that's why Connect saw that problem and came to exist. It's really, how do we engage each other in a meaningful way? How do we make sure all the voices that need to be at a table to solve a problem are there? So it's very much, sorry, it's very much, that access point to all those voices. And we really lean into that. Our best programs have come because our communities have identified the challenges, but most often the people who are most close to the problem are the ones who are able to identify the solutions. And so often the municipalities are unable to be a voice at that table. And so another really important thing that Connect does is be that voice. And so what do? We convene and we communicate for our regional membership. We co-develop and research advocacy agendas. We incubate and pilot policies and programs. We never purport to own a program or an idea or any of that. But what we do is, raise those voices to the top, or, to the point of the conversation. And we make sure they're at the table. We'll often say, if you're not at the table, you're on the menu. And for a lot of things in our region, it's really hard for elected and appointed officials in the municipalities outside of the city to be able to be at the table because they have full-time whole other jobs. But they are really important because they are our closest thing to direct democracy, and they know better than anyone else what's going on in their community. So being able to convene them, facilitate communication, develop research and advocacy agendas together allows for them to then pay a staff to come and sit on those tables and make sure their voices are heard and that their problems and their solutions are viable and available. And at the same time, we're hosted by the University of Pittsburgh. And so it is really nice that we've got a lot of access to cutting edge research, faculty with big ideas, and support for a lot of these programs. And so that's been really nice. This is a quick timeline of a lot of big policy and programs that Connect has been able to push forward in the last decade. We've worked closely with the city on all of these. And I'll point out a few. I'm going to point out the sewer regionalization implementation. That has been one of our biggest achievements, is just the amount of conversations and the amount of municipal officials who needed their voices heard to identify, problems with sewage, problems with backup, quality of life issues, for Alcosan to hear them. And, now and throughout all of that, it was a culture of collaboration, and Alcosan heard them loud and clear and has actually formed an advisory committee that has folks from Connect municipalities there to give their voice, which they didn't have before. And that was really important. A couple of other big things are Coordinate PA software. And so this is something that when you're thinking about budget, you can be very thankful that it exists now. I know you've all lived on a street that, got paved one time, the taxpayers paid for it. You're like, okay, great, no potholes. The very next year or 6 months later, the utility comes and digs it all up. 2 years later, water company says, oh, we got a problem, we're gonna get in there. But a lot of those times, the utilities have had that maintenance scheduled or those things scheduled for years in advance, but there was no mechanism to plan together. And so through Connect's Utilities Summits, and then through their work with PA One Call, they said, hey, we could plan together. If we don't really want the taxpayer / ratepayer as a human paying for the same thing 3 times, none of us do. That's so inefficient. And when we know we have $10 to $20 billion of an infrastructure investment coming to our region, what if we did that 10 to 20% more efficiently with each other? Think about how much money that is for the things that we say we don't have money for. And so the software began to get developed. And so now, anytime there's a project that's on a road or a dig, it goes into the Coordinate PA software, and folks are able to plan. And so, municipalities like Bellevue and the city of Pittsburgh have saved tons of money by coordinating with the utilities on roads that need to be paved. So that's just one example of, I don't think any of us sitting around a table would have figured that out by ourselves or without input from municipal planning directors or from the utilities. It's just that point, just that example I want to share, is you really need to have as many community voices that are touching the problem to be there to help find a solution that's really awesome. And so that's just, an example I like to point out. Another one is the Connect Community Paramedic Program, the Transit Oriented Zoning Project. And, now we're in a great funded partnership with the health department. And so I just wanted to share that timeline to give a little context on how much we can do when we work together and we hear from the people who are affected most by the problem to what they think the solutions can be. And Connect is really, really happy to play that role for folks. We've got 3 these cross-sector, cross-boundary working groups where we bring together our executive committee members, but then also the members of the departments that are working closest to the issue, the persons whose day-to-day job it is, either at the city or the county or an NGO, to do the work. And then they can get the feedback from the elected and appointed officials who are getting it directly from their residents to kind of work through solutions. And so we've got the Infrastructure and Utilities Coordination Working Group. In there, we talk about stormwater issues and regionalization of governance. We talk about the Coordinate PA software, and we talk about the Western Pennsylvania Energy Consortium, which we work with very closely with the city as well. And then we have the Economic and Environmental Development Working Group, where we're talking recycling coordination, transit-oriented development, lead safety in building and in the built environment. And then the one that's most applicable to today is our Public Safety, Health, and Human Resources Working Group. And you'll notice that these are sometimes concepts that that weren't as commonly put together as intersectional, especially the Economic and Environmental Development Working Group. But the Public Safety, Health, and Human Resources Working Group is dealing with the intersection of law enforcement, with diversion, with the 2020 census, with the volunteer fire crisis, and then just this culture of community policing. And in our working groups, I wanted to share, this is a little bit outdated and we're going to update it, but this is sort of the web of the partners, and each of these red dots represents an NGO or another government agency or department that is at the table of these working groups. So you'll see the Allegheny County Health Department, you'll see DHS, you'll see Economic Development, but then you'll also see folks like the Allegheny League of Municipalities, Three Rivers Wet Weather, Women for a Healthy Environment, Western. So what you see here is that you can follow my mouse. So you've got the Infrastructure and Utilities Working Group, the Economic and Environmental Development Working Group, and the Public Safety, Health, and Human Resources Working Group. And so a lot of intersection between all of this, which means keeping the communication and really getting feedback from all of these stakeholders is complicated and does take attention, but we really think it matters in creating a solution. And so when I want to hand it off to Joellen, to sort of talk a little bit about the process that we have done that in the past, a little bit more specifically. Joellen's been with Connect. Joellen Marsh is our director in our diversion program pilot that we've been funded through the Allegheny County Health Department. Before that, she was working at the health department herself. And before that, she was studying deeply diversion programs at GISPIA working with Connect. And we're really proud to have her. And then I just wanted to introduce also Mayor Kelly Kelly, who is the mayor of Turtle Creek, but she's also our community engagement specialist. And it's great to have them both here to sort of lean into, as the city begins to talk about, investing in restorative justice or investing in human services, how many kinds of stakeholders it's really important to have at the table when you start to envision what could happen next, or really mapping out what resources are available currently and how do you build those linkages? So you saw those red dots, there's all these linkages. We really want to strengthen those. If there's a breakdown in any one of those linkages, that doesn't exist anymore. The dot might as well be off the map. And so we want to be I just want to hammer it home that, those linkages are so important for all of this. And that is something that Connect is an expert in. And we're very honored to be here to kind of share that with you. So Joellen, if you don't mind just kind of going into some more detail on the intersection that we found with public safety, health, and human resources in that working group. You can mention some of the folks that we have. And this week is a special week because it's Civic Action Week at the University of Pittsburgh. We've actually opened up our public safety, health, and human resources working group to all of the public to see how you can get engaged with these kinds of topics. And so folks are welcome to check out the Civic Engagement Week calendar at Pitt and, join us tomorrow at one to sort of talk about this in much more depth and be a part of that working group, be a part of, brainstorming solutions. But Joellen, maybe you can give us a little more.
Sure. Thanks, Lydia. And thank you for inviting me. I'm so happy to be here. I get really excited about talking about public health and public safety and all of these intersections, because that's what I've been working on the last few years. I went to meetings when I first started getting involved with Connect and just heard local governments talking so much about their communities. And I just really want to reiterate some of Lydia's points that we recognize that community members are the experts on their communities, and we need to treat them that way. And I think as local government leaders, you see that the most. You're seeing them every single day and just hearing about their problems, their needs, their dreams, and also what they think will work for them. And what we've really focused on with Connect is bringing together the expertise of local governments and their voices of those community members together with the expertise of the people who are working in these fields every single day, who see how the systems work and really see what can be meaningful for people if they're just brought together. So one example of how Connect has done this, Lydia mentioned the Connect Community Paramedic Program. So that's an example of somebody who worked in that field, Dan Swayze, who ended up starting it. He saw that there were all of these people who were frequent flyers to the emergency department. So they were going, 10, 20 times a year to the emergency department. It was causing burnout among EMS. It was costing a huge amount of money to the healthcare system, and people's needs weren't being met. Most importantly, people were just kind of being left behind and falling through the cracks. And so we had this idea that he brought to local governments, and local governments said, oh my God, yes, please do that, where they would go in and they would just meet with people and really listen to them and say, what do you need? What can we do to help you? And sometimes that was buying a fridge for somebody who didn't have some place to keep their insulin. So we know that sometimes the solutions that are most important are not things that people are going to think about unless you actually talk to people. Another example of this is when the opioid epidemic started happening, when that really started ramping up in 2016, our local government leaders came to us and said, hey, people are dying in our communities. What can we do about this? So Connect went out, made connections with the county health department, with DHS, with all of these agencies and partners to say, what is it that we're able to do to bring these solutions back to the community and help them understand what the solutions are, and also that some of them already existed. So figuring out all of these things, and that's how I initially was hired through the health department, was to be that advocate within the county, within all of these partners, to bring people together to talk about these solutions. And then really focusing on centering community voices. We know that we can't do this without them, but also looking upstream, like we looked upstream with EMS and figuring out how do we solve those things before they get to an emergency, or how do we fix those things before it becomes a cycle? How do we interrupt that cycle? Looking at doing the same thing with police. So we've been working with a number of municipalities to explore what are the options we can do with police, whether that's pre-arrest diversion, other community policing measures, to figure out what can we do to give police the tools and resources, to give community the tools and resources, to give advocates these tools and resources, and figuring out solutions of what's going to make people's lives better, what's going to be more efficient, and what's going to be more effective. And so I think really just focusing on listening to each other and building those relationships, because if people, even if an amazing solution exists, if people don't trust it, they're not going to use it. And that's why local government leaders can play such an important role in helping to build these relationships and build trust so that community members are able to access the things that they need. Thank you, everyone.
Thank you. I don't know if Mayor is going, or is she just here for questions? I don't know. Mayor, did you want to chime in before we go to the council?
Thank you. No, I was just here really for questions, but
Okay.
again, being brought on to work with these programs just from a local government perspective is amazing. I have been advocating for programs like this in our municipality since I was elected 6.5 years ago. So being able to be involved with Connect, an organization like that brings our voice to the table and those of the municipalities around us to the table to get those services that we need and talk about what we need and what our residents are struggling with is wonderful. So I'm happy to be here and be a part of it, and happy to answer any questions.
All right, no, thank you for being here. We're also joined by Councilwoman Gross, So I want to thank her for being here. We'll go to the county, and I'll go to Aaron next, and then we'll get Dan from Allegheny Health Network after that. So Aaron, if you wouldn't mind taking it away.
Yep, great. I can pull up some slides. I know we shared them with your office, Councilman, but if it's easier, I'll, unless I hear otherwise, I'll go ahead and pull some up. All right. Let's see if I can do this properly. Is that working? You guys see my slides or no? Yes, no?
I do not know.
All right, let me try again. Here we go. I think this will work actually. Yeah?
Oh, there we go.
All right, great. Okay. Thanks. Hi, I'm Aaron Dalton. You guys hear that? Let's see. All right, good. No echo. So I'm Erin Dalton at the Department of Human Services. I run our Office of Analytics, Technology, and Planning, and have focused on a lot of our human services, criminal justice related work over the years. Appreciate the invitation to come and talk with you all. I'll try and keep our comments relatively short. I have Jen Batterton also with me. She's been supporting this work and happy to help answer some questions. And happy to follow Connect, who's done a lot of work leading in getting municipal and police department voices on this issue. So I appreciate their work. So just a little bit of DHS 101, just to make sure people are aware. So, you know, we are the largest county department. We have about $1 billion in funding to serve people. We serve about 1 out of every 5 county residents. It's about 200,000 people per year. And we serve a lot of folks in the city, right? So disproportionate to the population of city residents per county, we serve, you know, 50,000 people a year. And we do this work through a lot of community-based providers. So DHS doesn't tend to brand our services. We tend to do this work through community-based providers who we fund. You know, I think it's a long belief that people are more likely to get services in their community from their community than you know, from the government per se. So you might not see us so visible in the community, but we are there and do a lot of work in the community. So just again, a little bit of background on our values. So our goal is to be part of the community, have the services on the ground, really strive to always listen to the people we serve, build for, fund what they need. Long value around integrating care. People shouldn't have to do that work on their own. We should try to take all of these disparate services and make them work for people. We definitely do our work through partnership, whether it be with the school district or the courts or community-based providers or groups like Connect. Don't want to be in this alone, want to be supporting broader initiatives. Certainly a goal always to try to learn, improve, get better, and really do try to, and you know, increasingly try to put racial equity first. We know that if we serve people that are most vulnerable, most disadvantaged by our systems, that everything will get better. So just a little bit about our how we approach the work. We've got a lot of responsibilities, so you may know all of this, but we have responsibility for serving people, older adults and people with or without disabilities. So our aging services, we have responsibility for child protective services, mental health services, both Medicaid and uninsured, and as well as drug and alcohol, intellectual disabilities, emergency shelter and housing supports across the board, including for people who are homeless, job placement and training, though we've done a lot of work these days through Partner for Work. We still retain some You may be familiar with our 28 family support centers. We do a ton of other prevention and family support work, including after school and summer programs and so on. So just a little bit about our responsibilities. I want to just focus in for a second on mental health services, our behavioral health services, which for us encompasses both mental health and drug and alcohol services. I should mention in that about $1 billion funding, about 5% of that is actually county dollars. This is mostly federal and state funding for human services. The behavioral health services are about $450 million, the majority of which goes to community care behavioral health, who run the Medicaid programs for us, but and then we directly run the programs for uninsured, but have responsibility for both. You can see here, so it's everything from outpatient services to inpatient to peer supports, crisis intervention, which will focus on medication-assisted treatment, recovery housing, and so on. So a whole range of behavioral health services. And this is on our website. We try really, really hard working with the United Way and others, but still striving to make access to care easier. Certainly a lot of people are finding our services, but try to make tools like this available, work with applications like Big Berg to make services better known. So this is, for example, a location of our licensed mental health and substance use treatment facilities, and you can find this on our website. You'll see lots of them within the city of Pittsburgh. Just to talk about crisis services for a second. So this is not a full list. We will send out, we've done some mapping work with partners on this call to see where the crisis services are. And in my view, we have a lot of crisis services, some paid for by the county, a lot of them, some paid for by the city and so on. What we don't have, and I think we're working to build together better, is a crisis system. So things that fit together for people so that they see it, whether you're a family member, a person in crisis yourself, or first responders see this as a crisis system. So we have mobile crisis services through Resolve and community treatment teams. You'll hear a little bit about homeless outreach later, some of that through our own staff and other providers. We do overdose prevention outreach, again, through a bunch of different providers, including Prevention Point and the Centers of Excellence. We have a Central Recovery Center over on the south side, run by Mercy, that can serve as a couple of day stay for people in crisis, mental health crisis. We're working on 2 bigger projects that a lot of you will be aware of. The name for now is the Engagement Center. This is really to be the front door for the substance use treatment system, so that people in substance use in need of care, whether they are coming there on their own, family members support them in coming, or first responders can work with the Engagement Center to get people into treatment immediately. And then Project Cares, this is the shelter and drop-in center being developed. So just wanted to highlight some of the crisis services we currently fund. And I'm not gonna spend a lot of time on this because I think there's a bunch to get through, but Resolve is probably the biggest crisis, mental health crisis services. It's 24-hour, 365 day a week, day a year, crisis service that's free to all residents. We fund this. The government is really the only funder, and I think that's one thing that is a challenge, that the private insurance isn't covering this. So if I have private insurance, if I need this service today, the government's going to pay for that. And so that's something to look at least I think we should be looking at, just because these crisis services are so important, and with better funding, we might be able to do more. But we offer through Resolve mobile crisis teams, 24/7 crisis hotline, walk-in center, and residential services. All right, so I'm going to talk just a little bit about, and this is certainly not perfect, but I don't know, I'm a data person. So the intersection of human services and criminal justice, a little bit about what we know and what we're trying to do. So this is national data. I think it's fairly well known, reported on a lot. We know that throughout the country, jails have become the largest mental health treatment facilities, with so many people ending up in jail who have underlying behavioral health conditions. We know that 1 in 4 people shot by the police are people with mental illness. And we know that half of all people with mental illness will get arrested at some point in their lifetime. So these are, I mean, I think even though well-known, pretty shocking statistics and things, I think we want to look at locally. It's difficult to really use the 911 dispatch data. I think police, if you had an officer joining, or even the chief, I think they would estimate that they are spending a lot of time on behavioral health related underlying human services needs. And we do find across the county about 1 million dispatches from 911 a year. That was in 2019, that involves some kind of behavioral health human services issues. So mental health, overdose, alcohol, intoxication, and disorderly conduct, some of which are not real underlying human services issues, but a lot of which are. Those calls do take we've done some analysis working with the Pittsburgh Bureau of Police data. Those calls do take longer. I wrote it down somewhere, but I can't find it at the moment, but we can tell you the number of hours an estimated number of hours we think that they're spending on those kinds of calls. So trying to get a handle on how much of this is driving their work. Here's a density map, clearly the whole county, but you can see a lot of density within the city of Pittsburgh. And we've got provided for you here the top neighborhoods in raw counts for behavioral health dispatches. And then the top 20 neighborhoods in the city of Pittsburgh by rate. So one's count and one is rate. So you can see the neighborhoods that are most impacted. And many of you will not be surprised by this. Just moving on to thinking about the jail itself. So, in the past 20 or so years, you've seen pretty significant decline in crime. But the jail population has continued to increase over that time, only in the most recent years starting to drop. And just by the data, you've got a lot of people in the jail who have underlying mental health services or mental health service needs. 36% previously accessing mental health services, 32% substance use services, 6% homeless services, 56% emergency department services. And when we look at this by race, we find that Black people in particular, are not accessing as many of those services in advance. So we're not reaching people with these perhaps preventive services, and they are perhaps ending up in the jail due to their human services needs. We know the numbers are even higher for people who cycle in and out of the jail. And we know it's not just our jails, right? It's our emergency departments, our homeless system, our mental health crisis services. Just looking at frequent utilizers of mental health crisis services, we find that in the year following those episodes of significant mental health crisis, 40%, it's a huge number. You never see that in the homeless shelter data. 40% accessing homeless shelter services in the year following. 80%, staggering number, accessing emergency department paid for by Medicaid. And again, really high numbers of people being arrested and booked. And so, what can we do together to better serve people who are cycling through these systems? And I just wanted to note that we've done a lot of analysis using City of Pittsburgh data and other broader criminal justice and court data, combining with human services information. This is something that many cities and counties can't do across the country. So I hope you take advantage of some of that analysis, and we are happy to do other analysis to support your work as you proceed. So what are we working on to help improve crisis response and keep people who don't need to be in jail? I mean, I think folks know this, but the vast majority of people being held in the jail are pretrial, right? Very few sentenced or convicted of their current charge. And so I wanted to touch on some of the work that we're doing there. All right, so We've, as I mentioned, as kind of our values, we are always trying to improve the supports we provide. There was a time, a bunch of years ago at this point, where the justice system wasn't really ready for human services engagement in their work. That's certainly changed. You can hear that from the mayor. You can hear that from Connect, and that there's a real desire to be working together differently now, and certainly a real demand from the community to do so. So in 2017, we issued an RFP to take an independent look at our behavioral health and justice system supports, knowing that there might be more we could do, and wanted an independent outside look. So we received our final recommendations in 2019. There's a picture of the report, a link to the report there, and have started taking action on those findings as of 2019. And I think, there's a bunch of findings there, but one of the biggest ones is that we have a lot of supports further down the system. And so there's a real need to be looking at the front end, right? What happened? How do we make sure that people are supported so that they are not in crisis? And how do we support them in kind of this pre-crisis, crisis step? So I'm going to talk about most of the stuff not in red in a bit, but I wanted to just mention clearly, like, one of our key goals is to make sure, whether it's one-stop human services hubs or something else, that people can get access to the services, get assessed, get triaged, get enrolled in care in a welcoming, non-judgmental environment that incorporates peer support. We want this early. We want this available throughout the community. And COVID has caused us to rethink some of the ways we think about this work, but just a real acknowledgement that we need preventative and supportive care prior to crisis. So there's been a lot of discussion, I think, or interest in this idea. So I wanted to spend a little bit of time talking about the crisis response stakeholder group that has been convened and has city and Connect representatives, as well as others, chaired by Matt Brown, who's the Chief of Emergency Services, and Mark Cherna, my boss, who's the Director of the Department of Human Services. So we've just convened this group, and the goal is to understand the system better, hear from stakeholders and people impacted, identify new interventions and investments, and enhance coordination about with existing and developing new interventions. So just a little bit, I'm nearing the end, so hold on for it. But so some notes of vision here for this improved crisis system. As I said, I think we have a bunch of services. They are somewhat disconnected, and they're not everything that the community needs at this point. So we want these crisis supports and services to function well together and center communities of color in those services. We want fewer people to be in active crisis in this, on the streets and elsewhere, so that they get the services they need before they're in active crisis. Whenever possible, law enforcement would not be the first or only response to people with underlying behavioral health needs, intellectual disabilities, or those who are unhoused. Jail incarceration is no longer used to connect people to needed behavioral health supports and treatment. That still happens far too often. And part of that is education, and part of that is we need to have those services ready and on demand for people. So there's a lot we need to do as well. And that people have more and easier access to structurally competent, culturally humble, trauma-informed human services in the community. So, as I've already mentioned, the objectives are to identify gaps and opportunities, research. We've done a lot of this, but continue to research best practices and models in other jurisdictions, learn from people, hear from people, co-design with people with lived experience in our systems, those most impacted. Build consensus across our service, our systems, our stakeholders, our partners, the community, whenever possible, to have coordinated solutions that enhance the prevention, early intervention response, and post-crisis interventions. Understand and communicate how the group will advance racial equity in this process, and oversee the implementation, evaluation of those solutions, as well as ongoing enhancements. So we don't, we don't know what the groups are going to tell us. We haven't done all of the work. So I don't want to jump to strategies, but we think some of these things are potential and on the table for consideration. So expanding and or enhancing proactive outreach and engagement for people who are at risk of crisis, investing in behavioral health services and supports that are led and operated by communities of color, developing approaches that incorporate behavioral health and human service specialists into county's public safety response strategies. For example, dispatching behavioral health professionals directly from 911 or pairing behavioral health professionals with the police to respond to calls for service. Improve referral and connections between first responders and critical human services and crises. After crises occur, I'm sorry. So improving those connections between first responders and critical human services, and supporting agencies responsible for responding to those behavioral health crises to undergo racial equity transformation. So this is both in the behavioral health system. Also, we've started this work with the courts and other stakeholders. I just also, last two slides, I think, wanted to mention a related large county court initiative that does involve city partners as well. This is the MacArthur-funded Safety and Justice Challenge. The goal here is to reduce the jail population, redesign the jail to meet the new needs for the population, and reduce racial disparities in the criminal justice system more generally. We have a credible plan to get the jail to about 1,000. That's the goal. To keep it there. We feel there's far fewer people that need to be in jail than there are right now, and to again redesign the jail, hear from people, go through a redesign process so that we understand from stakeholders what is really needed inside the jail, how to make it as safe and rehabilitative as possible. So some of the strategies are here. I'll say, I just want to mention why the city and policing more generally has really, this has been going on for a couple of years, this project, and we're just bringing kind of the front end of the system into the work. That is because a lot of the efforts needed to reduce jail population, at least in the couple years before now, was really around time to case disposition. So court processing, moving faster. So a big portion of the work we've been doing over the past couple of years and still really have to do, it was expediting court processing. Now our strategies are much more inclusive of, for example, crisis response and reducing bookings at first appearance and so on. So I wanted to mention that. All right, I'm done. Jen, is anything significant you'd want or not that you'd want to add there or correct?
I just wanted to say one thing. The slide that Aaron talked through that had the 911 dispatch information, I just wanted to clarify that the top line number there is the total number of dispatches for the county. And then the table shows the breakdown of behavioral health related dispatches.
Yeah, this one here. Thank you. Thanks. Oh yeah, okay. Yeah, I said that wrong. Thank you, Jen.
Yeah.
Thank you, Aaron and Jen. We're also joined by, I believe, Councilwoman Strasburger. There she is on my screen. So I want to thank her. And our last guest, and then we'll take questions. And just so council members know, we will try to get these slides together for you and mail them out. I think it'd be easier to look in that direction. But if we can now have Dan go from Allegheny General, or Allegheny Health Network, sorry, to talk about his program for homeless and urban poverty. That would be great. And so Dan, I'll pass it off to you. Thank you.
Awesome. Thank you for having me. And it was really good to see Joellen and Lydia and Aaron and Kelly on here to talk about the work that they do in the community. This is a really good opportunity just to talk about all of the human services that exist, but more specifically, I think the area that we are working in at AHN is on street homelessness, mental health, and the co-response with law enforcement and public safety to look specifically at substance use and mental health interactions that they have around homeless individuals, and trying to support them as they do this work, because we've all recognized by now that this is stuff that they have been valiantly doing for a long time, although they don't have the training to do it, they don't have the resources to address these needs. And so this is something that we've conceived of as a complement to the work that public safety does and all of the other human services that Erin magnificently outlined in her presentation. I'm going to share some slides. Let's see if this works. All right, can you see that? So I can talk a little bit about my background first. Is that I worked for several years with Doctors Without Borders overseas. I was a medical coordinator for a refugee camp in Greece, in Lesbos, which was just recently in the news for burning down. But I returned to Pittsburgh, and I got engaged with Dr. Jim Withers, who many of you know. He's the founder of Operation Safety Net. And we had a long conversation, and he convinced me to come and work in the low barrier shelter, the winter shelter. And the first thing that I noticed when I was working there was that there are so many parallels between the individuals that we work with in this community that are displaced and homeless, and people elsewhere in other situations that are also dispossessed of home and all of their possessions. And there's a really strong drive to find community in all of these spaces, regardless of where they find themselves. There's always this incredible resilience that you see in people trying to build community out of almost nothing. And so, seeing that common thread in the work, it became a very natural progression for me to move into the shelter work, and then working as a case manager, program manager, going up through the organization, and running the outreach program at Operation Safety Net, which is doing incredible work. A big part of what this grant was, recognizing it as being able to address was the need for more of this relationship building that we've seen is so critical to the work with people who are frequently having very quick engagements with service providers. And there's high turnover in that staff because of all of the burnout as well. So looking at how we could create a system that was well supported, that didn't take on too much, but was able to base itself in a community and try to really address critical needs for people who have watched a lot of these relationships fall away. And that's something that street outreach has been able to do. And that's something that Jim and his model over at Operation Safety Net has pioneered now internationally, to work with people over time and recognize that these relationships are the critical foundation of every other intervention that we try to do in all of the service provision landscape. Without the trust and the respect with an individual, many of these things fail to really take hold. And so, you may be able to have, even crisis response, right? We look at crisis response and we see it as inhering within a broad spectrum of mental health response. But this is an acute sort of often one-off engagement. And then that individual may never meet with the crisis responder again. So the goal is to try to provide meaningful relationships that persist over time, and ideally underlie all of these other service engagements that people are having across the continuum. So with that in mind, we've taken on this ESG outreach expansion program, and I'll just give you a brief overview of street outreach. So this number fluctuates, but there are 4, sometimes it's 5, but county contracted street outreach professionals that are working in this space. Now, there are lots of volunteer groups that do this work, and they do incredible work. We've come actually to rely on volunteers in this space very heavily. The difficulties that presents are that there's a lack of consistency and reliability, especially sustainability around resources, and the provision of critical material goods that people need are sometimes being provided solely by volunteer groups. So that's something that we've seen and we've watched fall apart. We've watched groups start up and do amazing work and then fall away. So we wanted to make sure that we had created something that attenuated expectations for people and made sure that they recognize that this is something that we can do over time, and that it's primarily meant to address the difficulty around consistency and sustainability with these relationships. So, something about street outreach, and I've already mentioned it, is this extreme dedication and diligence that's required to do this work. It's very difficult work because in a given day, you may meet with 40 different people, all within some variety of crisis, and you may meet them under a bridge, and you might walk up on someone who's in the process of using, or you may be, given entree into an abandoned home where there's an entire family living and they just have nothing. And you have to walk through those engagements and try to understand the situation that they're in, but you really want to practice active listening. So you want to sit in that space with them and recognize that they already have an idea of what it is that they need. And it often doesn't match what you initially think they need, right? I mean, we project on people all of the time, say, surely this guy, he needs housed. This guy has been outside for 15 years. This guy needs housed. And he'll tell you, no, he needs better luggage, and he's just fixated on the luggage, or he's fixated on, getting a ukulele, right? And you're like, this is not your priority, man. But the reality is that without acknowledging the needs that are self-identified by these individuals, we fail to gain the trust and respect that form the foundation of the relationship that becomes basically a springboard for all of these other system and service level engagements. So that's the work of street outreach. That's what we try to do every day, is build those foundational relationships so that these people begin to open up and begin to trust that you have their best interests at heart. So, there are a couple of core elements, and I'll say first that this program that we're putting together wants to address the person on the street, the provider, trying to support providers and provide infrastructure for those individuals who are out there doing this work every day. Mostly they're driving to a community. We'll get a 311 request. We'll get someone, in maybe one of the councilman's offices that say, hey, we've got this guy. He's living in the woods behind someone's house. Can you do something about it? And they're popping all over the community, trying to often put out fires. But communication and infrastructure are lacking. And it's really just trying to wrangle a bunch of disparate forces, the volunteers that I mentioned earlier, the people that are contracted with the county, bringing them all together to have some sort of continuum of communication so that we're not duplicating services since we have so few resources to begin with, but trying to link everyone together that's doing this work and has been tasked with addressing these issues. And that includes first responders. So historically, we've had a lot of difficulty finding meaningful ways and sustainable ways to engage with first responders so that we can actually, intervene. Aaron and Joellen both mentioned these upstream areas of intercession, right? That is critical here. And every engagement with law enforcement professional represents an opportunity for engagement, but also it's an upstream, even if it's just above, criminal justice engagement, it's an upstream engagement that allows people to have an option to access a service rather than to have some perilous outcome. So, looking at first responders, looking at community in general, I mean, that's the core of this program, is trying to address the needs of individual communities. And Joellen brought up jurisdictional equity. That is sort of the underlying ideology here, which is that there are neighborhoods in the city and they are all distinct. Everyone here knows that. We have a rich tradition of very unique neighborhoods, and their needs are just as different as the cultures of these little enclaves. And so looking at that and recognizing that some of the needs in one neighborhood don't match the needs in another. And so we have to be able to accommodate these differences in the services that we provide. It's not a one size fits all approach. And so in order to do that, we've decided that, with the city, which in the RFP, they had said, we would like to really, really focus on zones 1, 2, and 5. So these are the zones that correspond to the police zones, and looking at these communities because they have a variety of different needs, and none of the 3 zones are the same, but we wanted to look at them and say, how are we going to address this jurisdictional equity piece? Some of the zones are saturated with human services. If you look at 3, you see Mercy's campus is right in the south side, and there's a lot of engagement that happens there, even though they have a high level of homelessness. 1, 2, and 5 are all sort of dealing with their own challenges. Downtown becomes the locus of a lot of the intersections of, you have what is often termed an urban service dependent ghetto, which is that you have this centralization of services in a dense area. And it's accessible relative to public transportation, but what you get is a sort of concentration of people with a variety of needs. And looking to understand what community means for the individuals that we're serving means trying to understand where they're coming from and where they ultimately settle. So, the North Side is an incredible community that has issues that vary very widely from, say, Homewood in Zone 5. And so what we've had to do is kind of address each one of these zones separately and say, how do we make this model meet the needs of each one of the spaces that we're going to be working in? So this is an org chart that I think will help give a broader understanding of what the team will look like that we're standing up here. So no one has been hired yet. We're just beginning, but what you can see here is that I'll start with the night integrated team in the lower right-hand corner. So this is something that we've seen time and time again working with people on the street. None of the difficulties that people face while they're outside align with at all normal business hours. And many of the services that exist are, operating between this 9 to 5 model. So where can someone go after hours? This is why police are so heavily relied on, because of their responsiveness, right? They are being called at all hours of the day and night, and they respond. So that's why we lean on them for a lot of these issues. The night integrated team is going to be going out every night throughout the week to canvass areas that are typically frequented by people who are experiencing homelessness. And the goal is to create relationships and engage with people who otherwise during the day may be doing something completely different. Maybe they're off doing odd jobs or panhandling wherever they are, but they're typically not in the camps. So this is an opportunity to meet with people, build relationships, provide resources for them, food, blankets, things like this. And there'll be a clinical worker with them too to address any healthcare needs. So this is something that we're really excited about because it's based on a model in Boston, which is, has been really, really effective in meeting with people. The other 3 you'll see are the integrated teams in the zones. Each one of them has a team lead, which will sort of coordinate shelter admissions. And then you have outreach specialists, which are the individuals that we're most familiar with working in the community, and then community health workers. The community health workers are people that are from those communities, and they understand the needs that exist there. And they also speak the language of people that are staying outside in these various zones. So, we already have a bunch of people lined up for these things, but they are the liaisons between all of the systems. They're relatable, they're personable, and they build these relationships with people on the street every day. And they will be, having those sort of meaningful engagements with people to try to loop them into to services. So again, this upstream intervention stuff that Joellen and Aaron both touched upon. These are discharge from the hospital EDs, jail discharge. These are 2 critical points of intervention that if we can move in and start to talk to people about, we might be able to prevent some downstream things. I know last summer there were several incidents involving people experiencing homelessness, and I think 3 of them had been discharged from jail within the last 48 hours. So how do we actually step in there and provide meaningful engagement with folks before they get into these situations? there's a lot of collaborative efforts going on in recognition of some of these crises that have been happening, which is really exciting. DHS is really leading the charge on this stuff, but the new shelter, which Aaron mentioned, is going to be an incredible hub. And then the Office of Community Health and Safety at the city is going to help coordinate with public safety, recognizing that public safety is put in these situations. How do we support them in doing this? And we've done some training with the police academy, and it's been really effective. So this is something that we're going to continue along with Colleen Bristow and the crew of folks over there at the police academy, and making sure that officers recognize that there are supports that exist, and also that people who are experiencing homelessness are very relatable and they're human. Lastly, I'll just touch upon the co-responder model, which is a big part of this pilot. It is the sort of the crux of a lot of the issues that we're seeing. And I think a big part of what we're going to try to do is build those relationships with the outreach workers and the community health workers, and then integrate those relationships into a joint case conferencing model with law enforcement and public safety, so that we can have enhanced and meaningful conversations about the same people that we're both engaging with, to try to find more durable outcomes for people that are staying outside. And the goal ideally is that once we've developed this reciprocal understanding of what our capacities are as human services and homeless services provider, and what the capacity of law enforcement is, or what they're willing to do, we can start having post-response where we'll come in and support individuals. I hope in concert with a lot of the efforts that Connect is pushing, and DHS with the crisis responder group. The goal ultimately would be co-response, which is to jointly engage with people on the street. And if the issue is something that falls within the purview of human services, then that would be handed off to them, and it would sort of mitigate the engagement with law enforcement and therefore criminal justice subsequently. So these are just some assessments that we had with our training. But overall, the public safety partnership is critical, and it's something that we're piloting and trying to better understand here. As long as we can support the individual communities in their engagements with public safety, and support these officers who are being put in these situations to try to manage some of the expectations of the community as well, I think we'll have a really, really interesting opportunity to try to, I think, shore up services that already exist, and Aaron enumerated many of them, but try to address sort of the joints of the system and shore those up, and galvanize some of the historical needs that have existed in this space. So that's all I have. Happy to take questions.
Thank you. Yeah, I think, all the speakers, and I see that we're joined by Council Member Coghill as well. And I'll get to council colleagues' questions in a minute. I just want to say that I think everybody in this conversation touched upon some of the key issues that we're hearing: collaboration, mental health, police training, different types of community policing models. I think all these things are great, and I think it's up to us to try to figure out how to bridge those gaps. And I know even, the model that you're talking about, or Dan just spoke of with Chief Schubert, and I had a conversation about this a couple months ago, and just trying these, new pilots, new collaboration with a number of entities that we usually don't see every day because they're countywide, or they're with a different entity that we only hear about down the road. So that was the big reason why we wanted to get everybody together to talk about what's going on, and how we, especially coming into budget season, and a lot of you were talking about funding, how we as council can, put funding behind that, because it seems like to me everything is a domino effect, and one ripple hurts everything else. So, for us to provide just one thing for next year, because the budget's going to be tight, will only help those individuals as well as public safety and the whole community. So my question would be, and you can answer it at the end, but if each one of you said to us, hey, $200,000, I'm just using a number, would go a really long way in bridging that gap. That's something that we would like to hear. And again, I don't want to put you on spot, but I think that's something as chair of public safety, when we look at the public safety budget, that's something that we need to know what those types of numbers could be coming down the road in the next couple months. So I just want to thank everybody for being here. I'll start in order of when they signed in, and I know Council Member Wilson was first, then Council Member Strasburger, and then Councilman Coghill. So I'll let Councilman Wilson take over. Thank you.
Thank you, Councilman, and thank you to all the speakers that came today and presented. I really appreciate all the knowledge, and I've had the opportunity to already start working with Mr. Palka, and it's been a pleasure. I wanted to, I guess I'll start with you, Dan. I wanted to, you alluded to, people that are coming out of the jail. During the time of COVID, there was, I believe there was, not as many people that were held at the jail. They were trying to limit the numbers. And I wanted to, someone else on the, here may be able to speak to that as well. Aaron, I believe you were speaking about the numbers in the jail, but really what services, have been provided, or what do we have in place for people in that situation, especially during times of COVID? Could you expand on that?
So I'll defer to Aaron to talk about the countywide response. But I do want to say that, when people were released from the jail and they were, released in droves, the difficulty we experienced was, how do we meaningfully plan for people as they're exiting the system so that they don't fall back into the same or worse situation that they had come into the jail from. So there was a day shortly after one of the mass exodus of people leaving where a new camp had cropped up because there were 8 people that I hadn't seen in months, and they had all said, yeah, we just got out of jail, and they were right back out on the street. So I bring that up only to say that planning and discharge is a critical space, and trying to work with people. I mean, they have a brief interaction with the social workers at the jail and then they leave. And that's not the fault of the social workers at the jail, but putting resources into that space will pay dividends later on, because that's one of those upstream interventions where if we just do a little bit of planning and ask someone, hey, where are you going to go? Do you need connected to shelter? Do you need connected to housing resources? Do you need connected into, whatever it is that they may need? That can go a long way, because we find a lot of people on the street that are, just out of jail and still trying to figure out what's going on with them.
Thank you.
Do you mind if I jump in, Councilman?
Please.
Just a couple of notes, just starting with the numbers. I just want you to know on Allegheny County Analytics, you can every day get the count. And so just we can show folks how to do that. So you can see that there was a really big decline. It has started going up a little bit in the past couple of months as arrests have increased, and the courts are challenged by COVID also to dispose of cases. And as I mentioned, and as you guys really, in a lot of cases, people aren't the people who are in the jail are not sentenced to the jail. For the sentenced medium to high risk population, who research suggests would be have the most benefit from services and case coordination and so on, we do have a reentry program that has been shown through national independent evaluation to reduce recidivism. So for those very few folks, right, I'm not trying to act like it's the entire jail, but for those few folks who are have the benefit of that, there is real reentry planning and support and coordination. We have something in the jail called the Discharge Center, Release Center. They are supposed to do all of the things that Dan, you just talked about. People are supposed to, not exit to homelessness and to living on the street. We do have transportation vouchers. We do have clothes and support. I do always need to continue to look at how those services are going, right? So we will do that. I'll see how the Discharge and Release Center is going right this second. And as you might expect, sometimes people don't want to wait. They don't want, they see that step as the step between freedom and, being locked up. And so sometimes we just can't convince them to let us support them at that stage. But we know that the first 24 hours after release, the first 48 hours are very critical around recidivism. We did also, just to note, I mean, we've been tracking recidivism, of course, we always track recidivism, but also of the COVID releases, and that recidivism was really, really low. I mean, it was a very strange time. So, but in any case, I do see the importance of this as an intervention point. We see it as an important place to support. We have tried to put in place some interventions there, but we'll look at them and always take feedback on how to make them better.
And Aaron, sorry, just to your point about the ability to even elicit from folks whether or not they are experiencing homelessness is very difficult. So even when they enter the prison, if you ask them, are you experiencing homelessness? Very often they will say no, even if they've been on the street for a very long time, because as you said, that may mean a longer term in prison or in jail. And the same goes for the emergency department. If someone goes into the emergency department for some need and they ask them, are you experiencing homelessness? Typically they will say no, because that might mean that they'll be, admitted for a very long time, and they don't know what that means. So they'll say no. So yeah.
Well, thank you. So as we, move forward with the budget and we consider costs in terms of services that the city provides, so I appreciate the post agenda on this. And Dan, the program, and Laura, you might be able to speak to this as well. The program that you're working on is a grant that came through the city, and we authorized this as city council. Is this something that, I guess the timeline on this, like how long do we have? And if we get reports back on, how productive it's been, or, how much, if we can show like how it's been, a great support system, what's the plan? Do we have a plan in place to capture that data and to really show what we've done here at the city, so that we can receive more funding or budget for this?
It's a very good question, Councilmember Wilson. I think right now we're as Councilmember O'Connor said, we're really trying to consider pilots, and pilots don't necessarily have a sustainability plan. And I know that's something that DHS has to think about a lot, right? Because when you're provisioning services to an entire county, pilots are difficult. But also I think we can recognize that the police and EMS in particular are under a great degree of duress, and we've got to figure out what's going to work. So what we're looking at now is a year, a little bit beyond a year. I think ESG HUD has given authorization for this program to extend until the funds are exhausted. And I can defer to Dan, but I know that CIH or AHN is looking at what sustainability models are. I think that the more that we can show value to police and to EMS, the more that they may be willing to see this more as part of their comprehensive set of services. I can just say briefly that I've been in city government for about 3.5 years, so it's not terribly long, but it's long enough that police during that duration have all said they need help, and I know that's what Aaron and Jen are focused on as well, that help is needed. And so if we can find a model that's going to remove them from these kind of situations where they frankly feel kind of helpless, they have to look and talk to someone who they don't have a shelter to take them to, they don't have a warm place for them to stay, they don't have food, they don't have clothing, they don't have anything, and they have to say to them, I'm sorry, the bench you're sleeping on is the best we can do. They want to not be in those situations, and we don't want them to be in it. So I think that there's a really meaningful case to police, even that if we're able to show to them the value as well, which they'll be working very closely with Dan and his teams, that this may be a natural place for the city to continue to fund as well.
I would like to chime in just a little bit. I would echo everything that Dan and Aaron and Laura have said. And I last year participated in a pre-planning process, just looking at what diversion would look like and just talking to people about their ideas. of more upstream kinds of interventions. And so many people said, we want things like this. We need them. We don't want to be taking people to jail in many of these cases. We know that if we take somebody to jail, a lot of times they're back in their community before we are, that we're still finishing the paperwork by the time they're back. And then there are other situations where people go and in the process, they might lose their housing, they might lose their job, they might lose their kids. That it's not just about getting people connected to things once they leave, but it's about preventing the harm that can happen just by sending them to jail in the first place. And I think I was really surprised by how many people from police to advocates to people within the criminal justice system really agreed with that and advocated for trying to find these more upstream interventions.
Okay, well, thank you. I have another question. I may have one later, but I want to give some other council members some time. The other question I had was, so you're providing like a resource for people, essentially. You know, a lot of people on this call or they're involved in the management of it. And, you know, I guess this is another question for Dan. You're going to be, I mean, I'm very excited to have you on the north side. And, you know, so I've taken some time to invest in learning about these services because, you know, there's been this commitment to invest in an area like the north side, where there is the need. So, you know, you're providing a resource. Can you talk about the resources that you have in place if you know the individuals that you'll be working with, and specifically, you know, on the north side for a long time, we've had a lot of faith-based organizations be able to provide the service, and you know, I always want to know, you know, is that what people are comfortable with that are experiencing these situations that they may be in? And do you have, you know, so that's a question, but then also, you know, do you have a, you know, if there's an issue there, do you have other resources available to you to give access to these individuals?
Yeah, that's a really good question. And it's something that comes up a lot. I think when I brought up the volunteerism earlier, a lot of the church groups and the ministerium and everything else, they provide really, really critical resources for people. And I think they're not county funded, they're not in these positions, but they do it out of a different imperative. So for the north side, you have phenomenal resources from a faith-based perspective. I mean, Light of Life is there, and they are a strong partner, and you know, for the entire county, really, for the entire city, especially. But to be in the north side, you have you know, a really dedicated group of people there, and they're coming at it from a faith-based perspective. Jarrell is a phenomenal partner, the executive director of Light of Life, and we've had endless conversations about how to integrate our services so that they can be complementary in that space. You know, and he's super excited about this. Jarrell is a former paramedic that went through the Center for Emergency Medicine, so he recognizes this stuff. He sees it as super critical, and he wants to bring more healthcare into the space that he's operating in, which is, you know, sort of unprecedented in that. And so, you know, they're putting up the new shelter in the north side, and we want to make sure that what we are doing serves as an access point to those sorts of services, if that is what people are looking for, but also recognizing that there's a whole array of other shelter options and services for people should they choose not to go with a faith-based approach. That's fine. You know, and Aaron listed all of the many services, and it's, you know, not even an exhaustive list. And the goal, I think, is to become almost a navigation center. So if someone comes in and they say, look, I had bad experiences with the church in the past, you know, I don't have a relationship with God anymore, whatever it is that they say, that's not an issue at all. But if it is something, you have that resource in your community to connect them to, and we have those relationships with their outreach team to connect them to that. So we don't see it as a barrier. We think of it as almost an asset in terms of diversity of approaches with regard to homelessness. How do we meet people where they are? If it's a faith-based approach, then that's what works, you know.
All right, I have myself on mute. So thank you. I appreciate that. And I'll open the floor up. Thanks.
Thank you, Councilman. I'll go with Councilwoman Strasburger, followed by Councilman Coghill.
Thanks, Councilman. And I really want to thank you for hosting this post agenda. It has been so helpful for me. I've taken the summer, this has been the summer of me educating myself and learning about public safety, about policing, about so many issues I was really ignorant about before. And this just is another layer on top of that, understanding the constellation of services that are out there that play into public safety overall, not just policing, but public safety, what truly makes people feel safe and comfortable living in this region. And so thank you all for presenting. And Dan, you know, you really did a great job of illustrating through examples what it looks like to meet people where they are and where different people are coming from and what kind of challenges that they might be experiencing. So thanks for that. One question I have is, I think the rhetoric we hear, and it's, you know, I think a strong belief by a lot of people that when we talk about mental health, that there's an actual brick and mortar place, right? That the rhetoric is, you know, President Reagan shut down took away mental health funding, and then all the, you know, centers closed, hospitals closed, and then we had no mental health services. Now, if we were to see adequate funding from any level of government for mental health services, this is a question for everyone, for anyone who can answer this. You know, what would that look like? My sense, what I'm picking up on, is that it's not necessarily like a brick and mortar place. It's not no longer just a hospital. It's a variety of different types of services, street outreach teams, services to train different people who are dealing with the public and dealing with different communities, so that they're embedded in, you know, policing and EMS and that sort of thing. That it is, you know, access to everyday mental health services proactively. But if someone could help me understand, you know, if we had adequate funding, what mental health services would look like. I know that's a huge question and a huge topic, but if someone's able to help me understand by boiling it down, that'd be great.
I'll defer to Erin on this one. I think she has a higher level understanding of what is possible here, but I think you're right on point, Erica.
Yeah, I think it's a great question, and I think it is the question we should ask of people in the community. What do they want these services? How do they want to you know, to get care? I think it does go beyond just like, you know, the whole conversation about social determinants of health in the more healthcare area. It goes to all kinds of basic needs. Housing, food, clothing, jobs. I mean, jobs, you know, is so much a big part, feeling productive is such a big part of people's well-being, mental health, and so on, people, connections to other people, and community. And obviously all of that feels so challenged during this time. So I mean, I wish even if I had a perfect answer to that question, I shouldn't provide it, right? I think we do need to talk to people about what they want right now, and allow them to help co-design what that looks like. I'll just say, I do really worry, and I'm not, you know, I'm not a mental health clinician, haven't spent my career really like in the mental health services. I have been at DHS for 12 or so years, so a lot of that wears off. I'll say I do really worry about what we as a society, this isn't just Pittsburgh or Allegheny County, how do we help people for the short periods that they are really in crisis and need to be safe somewhere? We have so little in terms of tools around involuntary care. And so people, you know, the jail is involuntary care. That's what people do because people can't be safe in their situation for that time period. Nobody wants to go back to you know, some situation with mental health hospitals that are inhumane and large, and like for people who aren't even in crisis at that moment, who stay there for years upon end. But I do worry about what we do, how we support people, how we house them for those brief periods that they're in real need. And that's a controversial topic, and people on this call might have ideas about that, but I think it is a really good, important question to be talking to people about.
Thank you. That's really helpful to think about. And I'll keep asking questions offline to understand this a little bit better too. I really also appreciated the conversation around, and many different people touched on this, not only developing a pilot like we are to be responsive to 911 calls, which I think, you look at a lot of people have been pointing to the Eugene, Oregon CAHOOTS program. And I've just read an article that Denver, after many years of sort of piloting, has gotten something off the ground. It sounds like Boston has as well, which I wasn't aware of. But I really like the idea of it being proactive also, and having, a recognizable van perhaps that drives around and people recognize, and it's a friendly service that people can take advantage of prior to actually needing assistance or being in crisis. But, as we're designing these plans, these pilots, any of these programs, what does community input look like? And, community can be defined in many ways. It can be residents who feel as if they are either over-policed or under-policed. It could be people who are recipients of these services. But what does that community involvement look like?
I can start on this one. I think there are a lot of ways to do this. And I think this is something that we're really just learning how to do this in a way that's trauma informed, that is taking into account what people are comfortable with. A lot of people don't want to come to a meeting every week and be able to be there, but they're willing to meet with you if you come to them. And you mentioned earlier meeting people where they're at. I think it's about meeting people where they're at, emotionally, but also meeting them where they're at physically, about going to them and saying, hey, what are the things that you like about this? What are the things that you need? I think one way that we're hoping to be able to do this is also be able to provide honorariums to community members who do take their time to share their expertise about things. There are a lot of people who have not been able to participate in community engagement before because they haven't been able to afford childcare, or they haven't been able to get transportation, or they haven't been able to get away from the 3 jobs that they're working. Or also they haven't felt comfortable in the space. So understanding that some spaces are really created for privileged white people and have not taken into account what is going to make people feel like they can really express themselves and express what they want. So I think those are some of the things that we've been thinking about, but it's very much a conversation of asking the community, how can we do this better? And really taking their lead on this.
Yeah, and I just chime in that, Joellen's right on point. What Jim Weathers always says is you go to the people and they will tell you exactly what they need. That's so true. I mean, in the engagements that we have with people on the street, this isn't a very mystifying process. If any one of us were to go, we don't have to be a professional in this space, and just ask someone within several minutes of that conversation, they would be able to identify what they themselves think that they need. And that's the most important thing. So the question is, how can we systematically do that, right? How can we actually create some mechanism within the policy and programmatic elements of all of the pilots that you're mentioning, Councilwoman, and just how do we actually inform policy and programming? And I think something that we've seen elsewhere that maybe we haven't had as much traction on, although I know that the YAB, which is something that they've really done a good job at DHS with, which is bringing together homeless youth and asking them, what do you think about this stuff? What do you think about the programming? What has your experience been? And seeing how that can provide really substantive input into the programming for youth who are experiencing homelessness. I think in the same way, we need to figure out how do we create community advisory boards that can bring people in, and we don't tokenize people, because oftentimes there will be a board and they'll say, we've reserved 1 seat for a person who has lived experience or is experiencing homelessness currently. Man, that is the worst model possible, because that person is under such duress in trying to answer questions. I mean, to Joellen's point, this is not a space that's been designed for them. It's incredibly, overwhelming for them, and they don't even feel like they can be truly honest, because typically the truths that they have to say are direct indictments of everything that everyone in that room believes to be true. So how do we create a separate space for people that isn't tokenizing, and that, as Joellen said, also compensates people adequately for this stuff? Because at that point they are consultants and they should be, compensated appropriately. So yeah.
Everyone on this call also knows that there's nobody on this call who, reflects the people experiencing these systems, right? And I'm certainly not judging the organizers of this call. We are often as guilty of that as anyone. So I think also in your work, which you guys, I think, want to do too, just acknowledging going to the source of information. We have information to provide, but the people experiencing it would have more to share with you. We aren't perfect in this. We strive to hire a lot more people with lived experience in the system. We have for example, a whole group of youth support partners. There are systems and people. They may not reflect all of the communities, and that's something we have to work on, but places and people like the Allegheny Family Network and other peer support networks have been built to support peers and community and people with lived experience. Again, they need to also be improved to make sure they're reflecting the whole community. Some people are not going to come to your table. They're not going to come to our table. They're activists, advocates in this work. They have a critical role to play, though, in providing information. And so I think, at least for me, when activists come together and provide findings and feedback, even if they won't and can't, for lots of good safety reasons, come to our tables, we do, I think, want to listen to what they're saying to us there too. So just to add a little bit.
Thank you. That's really helpful. Really, really helpful. That gives us a lot to think about too, in the way that we as council members in our maybe limited role, but also significant in some ways, can approach this. And then the last thing is, I see Brandon Forbes' name. Brandon, you don't need to turn your camera on, but when I was a chief of staff to my predecessor on council, he did a great job planning a council and I think state rep and state senator staff tutorial session or information session on DHS and how staff can utilize the tools that you have and all of your resources as we work closely with constituents and people experiencing different challenges. And, given that there are new staff on council and probably new challenges that we're all thinking about and facing, just wanted to maybe put that bug in the ear and see if we can help to bring that together again, because I found it tremendously useful as a staffer, and maybe we can organize that again. Thank you. That's all I have. Thanks again, Councilman O'Connor.
Yeah, thank you, Councilwoman. I think, a lot of the stuff that you were talking about in the letter to a lot of us sort of connects with all these things, which I think is great, especially leading into the budget. And we've been talking about it for a couple of months now. So I think it's good to hear this at the right time, right before we get started. I'll pass it off to Councilman Coghill. If he has any questions, then we'll close out. I don't know if anybody else has any more comments, but Councilman.
Okay, I'll be brief. First of all, thank you, Councilman O'Connor, for arranging this post agenda. I'm sorry I came in late because, I did listen in on it last hour and 15 minutes, I think, and it's been very informative for me. So with all the, challenges that we're going to have in the future and the conversations we're going to have to talk about policing and what it looks like, I want to make sure I'm part of all these conversations. So I apologize to those of you who I didn't hear. But Daniel, I did get to hear a good bit of what you had to say. And I got to tell you, it's refreshing for me to see something on a piece of paper, actual plan. We talk about social services and how they're going to come in and they're going to take responsibilities off of the police, which is a grand idea and would be great if we can do it that way. But I've yet to see anything. That's the first time I've ever seen anything which reflects a plan to me. And, for what it's worth, you're the first for me. So it's nice to actually see something, tangible. But saying that though, I guess I may have missed this, so I apologize if I did. But so we're talking really about a plan, a team of 18 people or so. You know, and I love the way you say a nighttime shift on there, because yeah, I think that's vital for outreach. So 18 people, and just figuring $50,000 in salaries, it's $1 million, I say, per salaries per year. Now, would the city pay for that, or how would we pay for it? I guess. Or do we not know that yet?
I will defer to maybe Laura if you are in a position to speak on that. It's a good question.
Hi, Councilman. How are you doing? It's nice to see you.
How are you?
You know,
Thanks for all your great work in Carrick. Laura has been a real champion for us up there.
I know we've been through some of these interesting community engagement processes before, so it's nice to be talking to you about this one as well. I think that's the right question, and I know Councilmember Wilson alluded to the same thing. I think you know, we know that this is going to be an extraordinarily difficult budget season for a lot of reasons, and I think you know, I'm sorry that Chief Powell is not joining me today, because I think Chief Powell has probably the most clear understanding of sort of how we're going to navigate this budget going forward. I do believe that there are some plans on the AHN side to look at what is reimbursable and what is possible. I think that we will probably, you know, I say we, but it's really the leadership coming from council and the mayor's office, looking at the budget over the next year and trying to understand whether this is a way that we remove some or alleviate some of the responsibilities that police feel, to the degree that they might almost feel that this is like a subcontracted effort, right? You know, if I mean, you know, I'm going to try to give an analogy about building, right? Because I know that you're a person that understands that. So forgive me if this is a little off, but you may be contracted to do the roof, you know, subcontracted to do the roof because that's what you do well, and the builder's willing to pay you to do that because they would rather see it done excellently. And I think similarly, you know, the police would rather see this work done excellently. They would rather not see that person again and again and again, because not only do they know that that's harmful to the person, but it wears on our first responders to see this person again and again. And I think the analogy that I've heard from some of the law enforcement professionals I work with is like, it's like seeing someone on train tracks and watching a train come increasingly closer to them and not being able to remove them, and eventually just having to contend with the reality of what's going to happen. And I think we see, you know, our first responders in the same position. And that's what's really incredible about GVI, is that, you know, Reverend Jones and his teams are trying to go in and prevent the next, you know, really tragic situation, and support people in removing them from those kind of situations. I mean, I think that's something that Erin's worked on for a great part of her career as well, is what are the upstream interventions? And I think police see that as, and EMS sees that as part of that. So, you know, I know that doesn't give a concrete number here, but yeah.
Well, let me tell you, Laura, that is right on along the line I was thinking. I mean, if we can actually justify, if we can say, well, the police department is no longer doing this, and their hours are very expensive, you know, if they have 2 or 3 officers at a scene that they don't need to be. Now, I don't think we could actually take that in the broad sense, like where we could exchange dollar for dollar. But I think what it will mean is that our police officers are being better used at things they're better equipped to do. And hopefully we get the right people in there doing the things. Does it mean that we're gonna be able to take a chunk out of the police department and give it this? I don't think so. But if we can say in the end that the police department is much more efficient because they're not responding to things. Now, what that looks like, that's another complicated issue, I feel. You know, I'll just give you, for instance, there was a woman on my street. Whoever made the call, she had a kitchen knife in her hand, and she was threatening. The SWAT team was there. I can't tell you what we had in expenses over a 12-hour period when I felt like this is a situation a social worker probably could have come in, been more effective without the sirens, without the lights. And, you know, the person would have been better off. First of all, it was mental illness, of course. And, you know, so, but it gets really tricky there. You know, when you send somebody, especially a social worker, how much are they going to charge us to go into a situation that they're unsure about? So there are all questions to be answered, and I won't go on much about that. But really hit the nail on the head. You know, we have to kind of justify spending for this, and hopefully it puts our police in a better position. And Daniel, I love the way you talked about each neighborhood is different. You know, in my neighborhoods, I'll say, I don't have a big homeless problem. And I love the work you do in that community. And I think it's good work all the way around. Fortunate, I don't have a huge problem. I do have it, but not, I don't think near the numbers some other districts do. But I guess moving forward, I'm thinking, hey, how are we going to help the police department? And what we're going to have to decide is a new form of policing and how we're going to budget it. But thanks again. Sorry I missed everybody, but little time I had here was very informative. I'm glad I chimed in. And Corey, I'll call you later. All right.
All right, sounds good. Thank you. And thank you, Councilman. Thank you, everybody, for joining. I think this is very informative. As I mentioned, a lot of the things you guys are talking about, a lot of things that we are all talking about is to help, not only our residents, but our public safety, as well as community policing moving forward. I think it's very important. Mental health, homelessness, everything that you touched upon. So I want to thank my council colleagues, and I want to thank all of our guests, and I will adjourn this meeting. But again, thank you. And if you had a slide, please email it to myself or my staff so we can get it to all council members. So thank you very much.